Congratulations! You've been released from isolation, whether recovery occurred in the hospital or at home. If you have previously been tested and diagnosed with COVID-19, but are now no longer restricted to home for the minimum 10 days, no longer have a fever without use of medication, and are no longer experiencing significant symptoms, or your symptoms have lessened, or you have tested negative, there's still more you can do to reduce the lingering effects your body may experience from the virus. It's important to note that because of how COVID-19 affects the lungs, some patients can experience breathing problems for several months following their diagnosis. The good news is that there's a lot you can do today to improve your lung function as well as reduce other lingering side effects. First, if your primary physician is not aware you had COVID-19, call them. Your physician can help direct you to additional care if needed, as well as monitor you as you continue to recover. Secondly, continue to self-monitor for symptoms associated with coronavirus. Viruses have a way of sneaking back up and continuing to affect your overall health. Again, if you experience any emergent symptoms such as trouble breathing, persistent pain or pressure in your chest, new confusion, the inability to wake up or stay awake, or bluish lips or face, seek immediate help. Monitor yourself for any new symptoms. Many people who have recovered from COVID-19 report experiencing post-intensive care syndrome, anxiety, depression, difficulty thinking and remembering, or significant muscle weakness and fatigue. If any of these occur, inform your physician, who again can direct you to the appropriate help. Thirdly, get your rest. Only you can determine the number of hours you need to sleep to feel rested. A good rule of thumb is the recommended 7 to 9 hours each night to allow your body to refuel and refresh. Next, eat healthy. Increasing your food intake if necessary and maintaining good hydration. Many people lose the ability to smell and taste, affecting their ability to eat. This can contribute to a loss of weight, poor nutrition, and a decreased immune system. You may need to increase the amount of food you eat in an effort to rebuild muscle mass lost. A diet rich in lean proteins such as fish and shellfish, skinless white meats such as chicken and pork loin, turkey burger, eggs, low-fat milks and cheeses, beans, nuts, and nut butters provide the fuel necessary to rebuild lost muscle tissue. Try to incorporate components of a Mediterranean diet into your eating plan, including brightly colored fresh fruits and vegetables, healthy sources of fat such as avocados and olive oil, and whole grains in addition to lean sources of protein. If needed, consider adding a protein shake supplement for the interim until you feel as if your energy and strength have returned. Fourth, ease back into an exercise routine, or begin one if you were not that active in the first place. Not only is increased activity necessary for good heart health, but for your lungs, muscles, joints, and bones as well. We want to ensure that while you are increasing your activity, you are also managing your activity levels so that your body isn't working harder than it should to perform those normal activities. You will want to closely monitor your body for adverse effects that didn't exist before you were diagnosed with COVID-19. Keep track of your symptoms and things that are more challenging, whether it be going up a flight of stairs or merely walking to your car. Rest is needed if you feel breathless or fatigue in your legs. Keep in mind, frequent short spurts of activity have been shown to be as effective as longer periods in building up your activity tolerance and promoting a healthy lifestyle overall. Lastly, listen to your body and mind and continue to protect yourself as you ease back into life. Even though you have had the disease, the information is not conclusive that you are immune to another episode. Continue to limit exposure to others who may be infected but may not know it, or those who are ill. Practice good hand hygiene, especially when out in public or in contact with high-touch objects. Cover your nose and mouth with a tissue if needing to sneeze or cough, or use the inside of your elbow. Maintain a distance of at least 6 feet from those outside of your immediate household. And cover your mouth and nose with a cloth mask to not only protect yourself, but also those around you. We hope you find this information helpful. Feel free to visit our website to learn more. And thanks for letting us help you to be well.